everybody. This quick video is just going to briefly explain generally how a prescription plan works within a health insurance plan. So sometimes it can be completely separate, where no matter what throughout the year it's completely separate from your medical plan, and you just continue to pay whatever your benefits are, whether they're copays or they're cost sharing. Sometimes you will have a deductible. So generally, how a health plan works, your prescription plan can work the same way in a separate entity. And your prescriptions, most companies, they hire out another company in order to run their prescriptions. So if you have a question about your prescriptions, you most likely will be transferred to an outside company. Um, let's see, sometimes they are all combined. Sometimes whatever you pay towards your prescriptions will be combined with your out-of-pocket maximum that we discussed in the other video. So that's just something that you have to take a look at and see which way your plan goes. One thing to consider is brand exclusions. If you right now take a brand name medication, you want to make sure that the health plan will cover that particular brand name. A lot of times companies will have contracts with certain pharmaceutical companies, and they will exclude the other company's prescriptions. And also the other thing is there are oftentimes generics available, not always, but most of the time there's generics available. So find out if the generic is covered and it's the same thing, it just doesn't have the brand name on it. Usually, obviously that's something to talk to your doctor about. I am not a pharmacist nor a doctor. And so you just want to take a look at that, and then also just be aware that there's often tiers. So that means you have like your brand level tier, and then you'll have like your preferred level tier, and then you'll have your generic tier. And you're going to be paying more at that brand level or your preferred prescriptions, and then less with the generics. So just wanted to briefly go over how a prescription plan works. They can be copay based or they could be deductible coinsurance based. Usually the higher premium you pay, the more likely it is that you're going to be paying copays. So it'll be a little bit easier to know how much you'll be paying each month going into the new year. So, all right, if you have any questions about prescription plans, I will try my best to answer them, but they're pretty tricky, but I will do my best. So write your questions below, and I will get back to you. And like I said before, if anybody knows the answer and I haven't got to it yet, feel free to be a part of the community and get a conversation going and help out a fellow community member. And yeah, I guess that's it. Thanks so much for joining me. Feel free to check out all the other videos I've done about choosing a health plan. And yeah, all right, stay awesome, guys. Bye.